I'm Mariannette Miller-Meeks from Iowa. I'm a physician, and I'm also a former director of the Iowa Department of Public Health. And liberty is critically important, but let's talk about science. Let's talk about science for a moment. Why is there a vaccine, and why is there a vaccine mandate? It's for immunity. So what does this mandate neglect? And the CDC and the FDA. It neglects immunity. You can have immunity two ways. You can have it from a vaccination. You can have it from infection-acquired immunity. We know from a CDC guideline that came out several weeks ago that said natural acquired immunity isn't as good as vaccine-acquired immunity. However, we know that the major vaccines are to the mRNA spike protein, not to the entire virus. However, this week, in the Morbidity and Mortality Weekly Report from the CDC, we find that infection-acquired immunity is as equally effective as vaccine immunity. So we should be talking about immunity and getting people immune. I've been vaccinated. My staff have been vaccinated. I administered vaccines in all 24 counties in my district. I am not anti-vaccination, but I believe that it is a choice. I believe that doctors and their patients and individuals should discuss whether or not to be vaccinated, what their risk factors are, and then we should make that decision. I can guarantee you President Biden doesn't know what your risk factors are. And if you're young and if you're healthy, what's your likelihood either to be hospitalized or to die? So we right now have hospitals that may be full. They may be full not because they're full of patients with COVID-19, but they may have no beds because they have no staff. And they may have no staff because we have a vaccine mandate that is overriding an individual's discussion with their doctors, with their providers, whether or not it is beneficial for them to get a vaccine. And the other thing I'd like you to consider, for a year, we went through a pandemic. We highlighted and applauded those essential workers who every day went to work, be it a clinic, be it a hospital, be it an FQHC. They went to work every day. They drove a truck. They worked in a grocery store. They worked in a restaurant, while the educated among us who could be at a laptop stayed at home safe and sound. They went to work every day, putting themselves and their families at risk to be exposed to COVID-19 virus, of which we knew very little. So for 15 months, they protected themselves. How? They socially distanced. They wore a mask. They wore PPE. They protected themselves. And if they were hospital workers, they protected their patients, and they protected our country from another 9/11 attack. But now we're saying you can no longer protect yourself and others that way. If you're vaccinated, what do you have to fear from somebody else who is asymptomatic and unvaccinated? If you are vaccinated, you are protected. If we're not vaccinated, we're at a danger. You're not at a danger to anyone. Continue the same policies that we had throughout the vaccination. Let people make a choice to be vaccinated or unvaccinated. Thank you.
Thank you, Doctor.